Hello friends, it's Karma, and today I'm here to talk to you about my Brazilian butt lift procedure. In this video, you will be provided with live footage of me in the operating room, as well as my before and after pictures, and just my entire Brazilian butt lift experience. If you're interested in learning more about my Brazilian butt lift experience, keep watching. So my Brazilian butt lift journey began at Marvel Cosmetics located in Nashville, Tennessee. There's also an office located in Tullahoma, Tennessee. I first learned about Marvel Cosmetics on a sponsored ad on Facebook. They had a free consultation. It was a very friendly environment. They asked me if I needed water just to make sure that I was comfortable. They provided me with a small packet for me to fill out on a clipboard. And basically the packet consisted of past and present medical history. They inquired about that, as well as what procedure was I interested in currently, and how did I hear about the Marvel Cosmetics. How did I hear about Marvel Cosmetics? The day of the consultation, Tammy was my representative and she was great. We discussed the slim lipo procedure on my stomach. It would have been my upper and lower abdomen as well as my flanks. The conversation transitioned into the Brazilian butt lift when I learned that he also does that procedure. So when Dr. Marvel did come into the room, and when I discussed with him my interest in the Brazilian butt lift procedure, he told me that it would be most beneficial if I got the lower abdomen, upper abdomen, flanks, and lower back. Also with Tammy, we looked at different body types just so I could get an idea of how my results would be, what they would look like, and things like that. We looked over those different body types on the computer, and then she told me how to move forward with this procedure. I would have to make a $1,000 deposit to secure my surgery date. Depending on if you pay cash or with a card, determines different rates may apply. You may have to pay an extra percentage if you pay with a credit card or care credit card or a debit card. I scheduled my appointment August 4th, and that was the day that I was supposed to secure my deposit. Deborah was my representative the day that I had my the day that I was securing my deposit and things like that. Deborah was my representative, and she was very, very great. And I have some footage of her taking my before and after pictures, signing like the paperwork, my pre-op paperwork, as well as just her sizing me up for my garment, all of that information. So here is some footage of that. Okay. Okay. Okay, 41 inches hips. Yeah, and then about 39 waist. What size dress do you wear? A 12.
About a 12.
10,
10, 12. All right. Okay. All right. Bye-bye. Okay, that's for your garment.
Okay.
And, let's see. Okay, so I gotta go get some different paperwork since you're gonna be doing it up at the, in Tullahoma. So let me go grab that. I'll be right back.
Okay. Oh my goodness. So I was originally scheduled to get my procedure done August 31st, but they just told me that I can get it done tomorrow. Ooh, ooh. Ooh. I'm gonna be big. I'm gonna be big.
All right. And then this right here is just, you know, your aftercare for the liposuction. Pretty much what I just told you, you know, is what this is stating about the drainage and it being, you know, blood tinged. Your activities, you could pretty much do whatever you want to. You know, you're not restricted. We really didn't cut you. So walking is encouraged. We really don't want you to go home and just lay around. So you could have the risk of getting a blood clot, you know, if you were to do that. So just, you know, as much as you feel like it, go along with your, you know, your normal activities. The first day, you know, you're not going to feel like doing much, and that's fine. You know, just keeping your binder on. Of course, you can take it off to take a shower, to massage, to throw it in the wash, but then just put it right back on. You're going to be sleeping in it too. And just be sure that you do massage. You know, we do want you to massage, you know, these areas, kind of go around to your back and massage, you know, through here, and do that, you know, 3 to 4 times a day. It's going to hurt when you do it, but you're going to have a pain medication that you can take, you know, when you do your massages. But, you know, I don't want you to get in there and just kind of rub it. You really kind of got to get in there and really, you know, massage it, because if you don't, it'll get hard on you.
Okay.
So you're not gonna like me when you do that. But, and you know, you're gonna kind of be taped up, you know, under your garment. You're gonna have like sanitary pads is what we use, and they're gonna be taped on you for the little holes. So you're gonna drain in that, you know, on your way home, and for the first day you'll drain in that. So it's just to keep you from messing up all your clothes and, you know, messing up your sheets and stuff at home. So the next day, you can take all that off. Okay. If it's, you know, if it's all wet and whatever, just take it off. You really should be finished with all the draining, and then you can take a shower. And then you can just put like a little Band-Aid back on the little incision, and that will heal up in about a week. So no baths or anything until that little bitty incision, which is teeny tiny, heals up. But you don't have to leave all that dressing on, okay? All right, so if you will just put your initials there, that I told you that. So is there anything that you do not understand?
No, I don't think.
Okay, I just want to make sure. So if you will stand back on my little dial, straddle the 3s, your feet on the black part.
Oh, straight.
Yeah. Okay, and then I just want your hands to be up like this. Just put your hair back. Yep, and your hands up like this. So I'm just going to have you kind of go around the dial for me. So I will just tell you, okay, straddle the 2, straddle the 1. So and first you're going to go in this direction, okay? Okay, straddle the 2s. Yep, your feet just right there at those 2s, okay? All right, the 1s. All right, the 4s. See how easy this makes it? Yeah, that'd be great, yes. Okay, the 3s.
It does make this easy.
Mm-hmm.
So after I took my pictures and after I signed my pre-op paperwork, I ended up having to pay in full because my surgery date was the next day. Originally, you have to have your payment made 2 weeks prior to your appointment. So the next day, my surgery was scheduled for 10:30 at the Tullahoma office. That was the only thing that was different. Originally, I was supposed to do it at the surgery center in Nashville. As soon as I walked in, I had to sign a paper that just stated that I paid in full. And then I waited into like the waiting room for like about 10 to 15 minutes. And this one of the nurses, she helped me. She had to take my blood, she had to give me a urine sample, and she had to give me a she had to take my blood pressure. So The reason why she said she had to prick, it was like more of a prick. They pricked my finger and they pricked my arm, right here on my arm. And basically she was like, that's just to see how long that I bleed. And after you pass all of that, when your pregnancy test is negative and all of that goes through, I was moved into a different room. And Michelle, she was my nurse, and she was so sweet. She made sure that I was comfortable, made sure that if she always asked, like, do you have any questions? Is there something that I can answer for you? She let me know what it is that was about to happen in the surgery room, as well as what was about to happen like after surgery. So she was very helpful, and she was just really, really sweet. She gave me my robe, which was like the paper robe, and I had to leave it out in the back. I had to remove all clothing, but I did have to put on compression socks just to prevent blood clots, since I was going to be laying down for a while. The procedure, I had to be there at 10:30. I think that they started maybe around 11:30, 12, and I know I was in the car by about 5. But I think the actual surgery procedures lasted for maybe about 3.5 to 4 hours. After Michelle had gave me my IV, Michelle, but Penny, she was really sweet, and she gave me her own special pina colada anesthesia, as she called it. She was really, really sweet. She had told me that there were 2 differences and asked me what was my option as far as the anesthesia goes. Anesthesia, did I want original anesthesia or sedation? I opted for original. The only difference was, one of them is when you're just knocked out cold and they put like the little breathing tube down your throat, and I did have some discomfort with that for the next couple of days. Or I could do sedation, and you're fully numb, but you're kind of in and out as far as you being asleep. So that was the only difference. I don't really know what the offsides is to sedation, since I used the anesthesia, the original anesthesia option. I can say that it did make me nauseated afterwards. Like, it made me feel seasick, whether I was just moving from the car into the house and things like that. Even when I was moving out of the hospital bed into the wheelchair, and I kind of got sick with that. So it did make me nauseated, and it did give me discomfort, but other than that, it was great. But after they gave me the pina colada anesthesia to relax me and calm me and put me to sleep, they moved me into the surgery room, and I was knocked out, so I don't know what happened from that point on. However, I do have the footage. Unfortunately, my camera went dead, so you don't have the actual footage of them injecting the fat into my butt, but everything before that is on the camera. So I hope you enjoy this footage that I'm about to show you.
We just scream one more time. Go ahead, scream. Okay, I'm ready. Lay it on me.
Pina colada coming your way.
Oh my goodness, I'm just so scared.
Oh, don't be scared.
I'm gonna try to stay up.
You'll do wonderful. You'll be awake now. Wonderful. This just helps you relax a little bit. It's just like having a pina colada on the beach.
Okay. I thought I was going to sleep in.
No, not yet. In a minute.
It's gonna take a while.
Well, we're not even in the other room yet.
Oh.
Put monitors on.
Oh. Okay. Never mind.
Ready? I was just going to see if you giggled a little for the camera.
Bye-bye.
Thank you.
I think I'm
And she's off.
I know.
So it's Dr. Marvel. We're with Brianna today in the operating room, and she's going to have a Brazilian butt lift or fat transfer to the buttocks. And the first step of this is going to be harvesting the fat from her abdomen in place. We'll follow that up with some lasering after we harvest and save her fat. And then the second phase of the operation, we'll turn her over, we'll liposuction her back, and do the actual fat transfer to her buttocks area. We'll go on with a pump, 100%. The first step of all liposuction procedures is to put fluid in to help us remove the fat more easily. So that's what we're going to be doing here initially, is putting the fluid in. The beauty of this operation is you don't only get a fuller buttocks, but we also get rid of a lot of fat around the center, the midsection. And that sculpts your waistline, get more waistline, get more of that hourglass top figure.
600.
It's a very popular surgery.
700.
We harvest everything we can, and then we see how much is there. Some folks will have to throw some of their fat away and not use it all.
Mhm.
Most of the time we use all of it to put into the buttocks.
Okay.
I would say, 800 on her, maybe 800 cc's per side.
Okay.
Some folks don't have as much zone A, and so we're lucky to get 200 or 300 sometimes. Okay, so now the fluid's all in. We're going to go and back over to the other side and start removing the fat. And it's going to be collected in a special canister over here. And we'll let it separate out, and that'll be the fat we use to transfer to the buttocks. We're using the powered liposuction instruments today. And this vibrates as well as suction, so it makes the fat come out a little easier. And you get more fat than with the traditional liposuction instruments. So we are ready. Suction is on. No, it's not. I don't hear it. If you'll turn on the suction. Okay, so show her the tubing in here. See the fat's now starting to come into the tubing. Step a little bit too. There you go. That's her fat. We're collecting it. It's going up in the tubing now.
Just go into that canister on the table. Back there, eventually.
So patients can actually do this awake, or sedated, or under general anesthesia. But the solution we put in there is very effective at anesthetizing, so it's not painful to do it awake. But when you have a long case like today, it's sometimes a little difficult to lay there for that length of time.
Mm-hmm.
Going to sleep is a great way to do it as well. Once we've gotten most of the fat out, we're going to laser this area with a slim lipo laser. And of course that fat has been damaged by the laser, now we discard it. But that'll let us tighten up her skin and also get out a little bit more residual fat. We'll be able to harvest plenty from here and then some more from her back when we turn her over. So we get out as much as we can initially. So some people don't have much fat and we use butt implants, but the difficulty there is they can't sit on their butt for 3 weeks, and it's a major inconvenience to the patient. So the fat you can start resuming, you can sit on your butt usually just a couple of days, and so it's a lot easier recovery for the patient. So if you have a little fat, it's good because that's what we can use to augment the buttocks with. And very thin people or don't have enough, and they have to have implants. Now we're doing a little of the flank area. And going back towards her back. We're we want to get all the fat off the plate to give the narrow waist. To give her a nice small waistline. And when we turn her over, we'll be getting the back fat and kind of joining in what we've done already, resuctioning the flank from the back side as well. So you might be able to zoom in and see how the fat's starting to collect here. The portion on the top is the fat and the fluid is below. And it kind of bubbles in there for a while, and we let it sit for a good bit before we take the fluid off, just separate the fat. We marked her prior to the surgery, so we stay within our blue markings, and we don't want to remove any fat from her hips because we want to, again, leave fullness in the hips. We're mostly going after the waistline here. A lot of folks have that sort of roll right here in the flanks that kind of distract from the waistline. So we're doing good on fat harvesting already. Looks like we've got, almost 600 of fat in there. We need all of it. We won't be throwing any fat away today. I think every bit of it we're going to use.
Okay.
Of course, the fluid is of no value to us. That's just, that would be absorbed immediately. We're only interested in the separated fat. Okay. We made some more room now. We can resume liposuction. Turn on the suction.
This is the little cannula that we were talking about, that we actually will put the fat back in.
So you can see how small it is compared to what I'm taking it out with. So
It's just using a longer version of this size. So you see the openings of this one.
yeah.
Patient that seen the other day, CT of the temporal lobe.
Yeah.
Good.
Did y'all reshoot it?
He's here. Should I go ahead and
Yeah,
do that?
reshooting because it wasn't no charge because it was a bad study and I will be there in a few minutes.
Okay, thank you.
Now we're going to do the other side. So we're back now with Brianna, and we are going to remove some more fat from the lower back to shape her waist, and then we're going to do the fat transfer to her buttocks. So the first thing I'm going to do is start making some marks on her. And we'll also be removing fat from the sacrum or the tailbone area as well. We're making some marks here. Okay, turn the pump on, 100%. Same as doing the abdomen, we start by adding fluid. You know, we needed 11 blade. This one was actually 15. As you get the weight smaller and smaller, you start to see, you know, that developing there. The most artistic part of it.
Well, thank you for watching my YouTube video all about my Brazilian butt lift experience. Feel free to comment below if you have any questions. Please like and please subscribe. Thank you for watching. Bye. See you next time.